And welcome back to One TV Episode 2. Today's topic of the day is all about Regional One Health, which is why, in addition to having Mayor Harris with us today, we also have Dr. Kerwin with Regional One. I'm not even going to begin to explain. Tell folks what your titles are and the multiple hats that you wear, which you have to do at a trauma center.
Yeah, I really do. So I wear a couple hats. So on the university side, within the Department of Surgery, I am the chief of the Division of Trauma and Surgical Critical Care. So I've been responsible for recruiting and developing 10 other surgeons that work in the trauma center with me. On the hospital side, I serve as the chief of trauma. And so probably the best way to think about it is maybe like a service line director within a hospital. So working on some of the finances and budgeting, programmatic things, equipment issues, space issues, efficiencies of the hospital, if you will.
Multiple hats, important work. We thank you for all the work that you and your team do. What is, for the folks at home, what is a Level 1 trauma center and why is it so important to our community?
So a Level 1 trauma center is really important for people that get hurt. And I always say people don't think they're going to get hurt. They don't think they're going to get in a car crash. They don't think they're going to get hurt trimming their tree or they're hanging lights on their house at holidays and fall off the ladder. And so Level 1 Trauma Center, you want they're readily available 24 hours a day, 7 days a week. And that's what we do. We're readily available. Trauma surgeons like myself, nurses, orthopedic surgeons, neurosurgeons, oral surgeons, ENT, radiology, vascular surgeon. Every medical specialty you could think of is readily available either in the hospital or available by phone to come into the hospital. Skilled nurses, skilled techs, therapists, radiology department, all the things readily available 24 hours a day, 7 days a week that are not available in other hospitals. That doesn't mean they're bad hospitals. Right. They're not available in regular emergency departments. Again, not that they're bad. Those things are just not available, and they've not focused on people who have been injured and have immediately life-threatening problems that need attention right now.
And that's the place we want to go if, heaven forbid, we need that kind of service. Speaking of that, Shelby County owns the hospital, is responsible. Does Mississippi and Arkansas, do they share any responsibility in that?
Most of the folks served by the hospital are from our part of the state, West Tennessee, and most of those are from Shelby County. As you say, Shelby County government owns the hospital, and so it's our responsibility to make sure that that hospital is enduring. It's going to cost significant resources to make sure that that happens. I'd love to be able to get a lot of that money from another place, someone else's pocket, Arkansas taxpayers or Mississippi taxpayers. I once recall a politician saying that he could build a wall on our border and get another country to pay for it. But the reality is that once you own something, whether it's the roof at in your house or the cars in your driveway or the hospital that sits in the center of your city, you've got a responsibility to make sure that it is available for the next generation. And for sure, Regional One is going to be needed for the next generation. And the only way to make sure that that occurs is for us to invest in it. That's going to take substantial resources. I can't pull the $700 million to $1 billion that it takes to rebuild this campus out of my pocket. It's going to. I know. So unfortunately, it is going to take us raising revenues, and these are not like waters that I enter into without some, anxiety, but it is necessary. Those are the kinds of investments that will last for generations, and those are the kind of investments that matter the most.
Great segue to this next question, which is about training future doctors and that partnership with UTHSC. Can you talk a little bit about that, Dr. Kerwin, and why that's so important and such an investment for Memphis and Shelby County?
It really is, and that was one of that partnership between UTHSC and Regional One was something that excited me to come back and come. I came back about 2 years ago into this position. And that appeal of that training program and the prestige of the training program, really it draws in people who want to be physicians, who want to get this experience. It makes our programs are not only known regionally, but nationally, and even some of them worldwide. And so that's really important to draw the trainees in, those residents and students, residents and fellows, to draw them in, and then take what they've learned and take it elsewhere. we at UTHSC have trained, I think, about 40% of the physicians at some point in their training that now work in Tennessee, somewhere in Tennessee. And so we have a tremendous impact on not only patients here in our community, but all around Tennessee, because the physicians that we train go out into other areas of Tennessee. And it's not only physicians too, it's nurses, it's pharmacists, it's CRNAs who work in the operating room, it's nurse practitioners. So it's a tremendous resource for us and for the surrounding areas as well.
And it's so great when we hear that storyline of somebody who trained here, went somewhere, and came back to give back to this community. So we're grateful for all the work that you and the staff at Regional One do every day, really, to protect us and save our lives, if needed, heaven forbid, right? Yes. And one final question for you, folks watching at home. Why should they care about this, and who should they contact to help make all this happen?
Well, it's only by the grace of God and good fortune that any of us don't end up in a predicament where we need the kind of care that Regional One delivers every single day. And one day, God forbid, our luck will run out, or our luck will run out with respect to our loved ones. And if we want the very best care available, that care is at our Level 1 Trauma Center, the only one in this region, located at Regional One. And so that's why people should care. That's why it's important and relevant in all of our lives. Talk to your neighbors, hear their stories about how they served in Regional One. You will be astonished by the impact that this hospital has had on families around our entire community. And so I'd ask people to use their voice and talk to their local elected officials and ask them to summon the courage to take advantage of this moment to invest in Regional One. Even though it's going to be hard, and even though we're going to need revenue to do it, this is our moment to make sure that hospital is available and enduring.
Thank you. That was great. Thank you for joining us today. And we appreciate all the work that you'll probably leave the studio to go continue doing.
Well, appreciate being here, and thank you for your confidence and support.